Hi, Dan Sokol, licensed psychotherapist. Wanted to talk today a little bit about what it's like to go to your first therapy appointment, what to expect, what kind of experiences you'll have. The first appointment is a really hard one to get to. After initially making a call, that's often really tough for people to go into therapy. It means admitting and sitting with the fact that there's a significant issue going on in your life and an issue that you want help with. So you make the call, you schedule the appointment, then you have to get there. Usually there's a lot of rumination, especially after the phone call's made. What will it be like? What can I expect? Will I be challenged? Will I have to divulge information I don't want to divulge? And it's different for every therapist. Some therapists, they don't want a history. They want things to evolve and come out naturally. Other therapists like myself, I want an intake packet filled out that gives me a little bit of information, a little bit of history, and also, ties into what the presenting problem is, what you're calling for therapy for. So that first appointment, getting there is pretty anxiety-inducing. So there's a lot of rumination beforehand. There's a lot of thinking about it. Sometimes people want to cancel because they can't handle the discomfort and the unknown. And really, I hope the intent of this video and the outcome of this video for you is to kind of have a sense of it and to feel a little bit more at ease what it's going to be like when you get here and when you go into the room and drive there. So I remember a lot of people telling me, and I remember my own experiences in supervision and treatment, the anxiety of starting with someone new. And what will they be like? What will they bring up? What will they find out about me? What will they accuse me of or challenge me on? All of these things, right? And also if we're dealing with pain and historical pain, what will come up and how will they sit with that? I've heard some really, really bad experiences with people divulging information and a therapist not really knowing what to do. So you want to make sure you have a good fit, that it feels right kind of going in. And usually you can by just perusing their website, doing an initial phone call, and scheduling the appointment. There is no mandate that when you go to a first appointment and it's a bomb, that you have to stay with that clinician. What I do say to patients is you really should give it a shot, a couple of months to really see if it's a good fit, to kind of process if there's kind of some mystery about why you don't like it, if it's about the defensiveness about sitting with your problems, if it's about that clinician themselves. But you want to kind of give it a little time. If it's a traumatic experience, get out of there. That's okay. There's kind of tiers of experience, right? If it's traumatic, they say some things that are just you don't feel right about, that's okay. But if it's about the anxiety and the mystery, you want to sit with and deal with that and sift it through, and you want to bring it up. So that first appointment, going there, scary, nerve-wracking. The reality of the first appointment, though, is it's really about the therapist to get a sense of, A, what your hopes are. Why are you going to therapy? What do you want out of therapy? B, what's going on with you presently? C, give me a sense of the history. Give me a sense of your life, your story. Not too much all at once. We don't want it all to just kind of show up, but the big points of it, significant events, good events, bad events, things that are tied to present worries. We want to get a sense of those if you have an awareness about that. And then towards the end of the session, it's really about having a sense of plan. I tend to work very intensely with people, but I also see people just once a week. Sometimes we work upwards of 2 to 3 times a week, and in most cases, either 2 times a week or once a week. It really depends on how much of the experience you want, but also how severe your symptoms are. If you're dealing with some pretty severe depression, we want to meet more frequently. If you're dealing with kind of a more generalized anxiety or a constant worry or what we call dysthymia, kind of this like lingering depression without suicidal thoughts, then we might do weekly. But it's a plan that's up to the patient. It's up to you. So you go to that first appointment, you're scared out of your mind, you're nervous, you're ruminating, you have all these kind of thoughts coming up. People often get worried about filling the intake packet. Don't sweat it. It's okay. You fill out as much as you're comfortable with and what you want. And then you come to the appointment, and we make a plan going forward. You rule the roost. As long as you're being respectful to the space, as long as you're respecting the boundaries of scheduled appointment, payment, those kinds of things, the basic social rules of when you go to appointment and the expectations, then it should be a very smooth process that you self-determine, that you rule the roost on. And you have the right to say, I don't want to go there, this topic, or it's too early for me to sit with that. You don't have to jump into things. I like to describe the process of therapy almost like a sculpture, right? There's a lot of chiseling that happens after much planning. And then when the chiseling actually occurs, it takes quite a while to get to the finished product. And there's a lot of jagged edges, and the product needs to be smoothed. And so it takes time. It's a process. It's not meant to be all done at once. And it's okay if it takes a little time. And it's okay to know. It's like little steps. The step of getting in the office is one of the biggest and one of the most nerve-wracking. I know I tend to be long-winded. This video is a little longer than some other ones, so I apologize for that. I hope it's helpful. And if you have any questions, don't ever hesitate to reach out. There are clickable links to my website and another video about what therapy is like that will show up at the end of this video on the video itself. I hope you have a great day, and I thank you for your time. Take care.